here we have our vet scan analyzer, our diagnostic profile analyzer. This machine is fabulous. It gives us a lot of different blood readings. So today I'm just going to be showing general maintenance. The first is just keeping this screen very clean. That's just general maintenance and cleaning. Typically we just use Windex and something soft, either typically just paper towels. And then the only real maintenance that we do is change the filter, which is right here. So I'm going to take it out, just like this. As you can see, there's the filter, and this is the filter that we change. So here I have a new filter for our diagnostic machine that I'm going to put in. So I just place it right back in the container, just like that, evenly, and then I put it back on our machine. And there's our new filter. Today I will be showing you how to do an ELISA snap test in-house. Today I'm going to be doing a heartworm test. So this heartworm test tests for the antigen that female heartworms actually give off in the dog's bloodstream. So right here we have our test. We have our pipette, our blood, which is in an EDTA tube, and our conjugate that we're going to be mixing the blood with. So first, I will add 3 drops of blood into our tube here. We're going to be mixing the blood and the conjugate together. Yeah, I think so. We have 1, 2, 3. Perfect. And then 4 drops of our conjugate will go in here. Perfect. And I will cap it off and gently invert it. Great. And I'm going to be putting it right in here. And then the blood will move up to here. And then once it hits this circle here, I will snap it down and then the test will begin. This test does take 8 minutes, so I'm setting my watch for 8 minutes and we'll read the result then. Here are our heartworm test results after 8 minutes. As you can see, the test is negative if the test was positive. So we have our control dot, and next to it, if it was positive, there would be a blue dot to the right of this one. Okay, so today I will be discussing a modified Knox test. So this specific test actually allows us to differentiate the different kinds of heartworms that are out there. The 2 different kinds are Dirofilaria amitis and Acanthocheilonoma reconditum. So this specific test will help us allow to identify each different one when we're looking under the microscope. So our first step, are the things that we will need today is 1 ml of anticoagulated blood, which I have here. Our 9% formalin, 9 mils of 2% formalin, our centrifuge tube, and our pipette for our blood. So the first thing I will be doing is adding our formalin, 2%. I'm going to be adding 9 mils into our centrifuge tube. Always be super careful with formalin, since it is a carcinogenic, just like that. And then I will be adding our 1 ml of blood, anticoagulated blood, straight to our sample. Perfect. And I'm going to add our top so we can centrifuge it, but first I will be inverting it just to mix it. Okay, great. And now I'm going to centrifuge it for 5 minutes at 1500. I'm now going to centrifuge our mixture of our anticoagulated blood and our formalin for 5 minutes. Okay, so I just spun our tube down, and you see here we have the supernatant. So I'm actually going to pour that off, just right into the sink. I'm going to be super careful not to disrupt the bottom of the contents. Okay, just a little more. Perfect. And now I will add just a drop of our methylene blue to our solution. Okay, so now we're going to be mixing it using a pipette. Just very gentle, doesn't have to be rough.
That's it, buddy. You're done.
Great, and I will take 1 drop of my solution.
All right, she wants.
And then we got to switch everything.
I'm going to put it on our slide.
All right.
But I already wanted the Metro liquid.
Apply a cover slide,
Yeah.
just like that. And then I can take a look under the microscope for microfilera. Okay. After close examination of our blood slide, I did not find any microfilera on the slide. Okay, so the main reason why we do fecal flotations, it does allow us to find several parasites: roundworms, hookworms, tapeworms, whipworms, as well as fluke eggs. For this specific test, it is common that we actually miss protozoan parasites, which is more, in that case, if we are looking for protozoan parasites, it might be better to do a direct smear. But for fecal flotation, just for common knowledge, flute eggs actually have a higher specific gravity for that specific test, so they will sink. So not all parasites will actually float to the top, but most will. So fecal flotations are very common in animal hospitals. We send them out probably 20 out a day. Okay, so today I'm going to start with doing a simple fecal flotation. So right here, the objects I have is my stool sample, my Fecatech solution, my centrifuge tube, and some gauze squares. I'm also wearing gloves just to make sure that I don't get any fecal matter on my hands. If there is any sort of parasite in the stool sample, I do want to make sure that I'm safe and I'm staying very clean. Okay, so the point of a fecal flotation test actually is that this fecal liquid actually has a very high specific gravity, which is higher than any parasites. So it depends on the life cycle of the parasites, but typically we do find some in the fecal float. Once the test is complete, if there is any parasites, the ova will float to the top. So to start, I have my fecal solution. And I will take stool, just 2 to 5 grams, not too much. And add it to my solution. Then I'm going to use a tongue compressor just to mix it. Really just want to make sure that it's pretty even, the amount of solution versus feces. All right, perfect. And now I'm going to fill it up to our 30 mils in our fecal container. Oh, I'm sorry. First, I need to strain it using our gauze. So I put the gauze right on top, just to make sure no large pieces of fecal matter go through. Great, now that we have this, I'm gonna let it sit for 10 to 15 minutes. Okay, now I'm just gonna add some fresh solution to the top just to form a meniscus. So I'm just gonna pour it from my big container into my smaller container. need. Just a little bit. Good. And now I will place the cover slide on top. Just like this. Now I'm gonna leave it to sit undisturbed for 10 to 20 minutes. It has been about 15-20 minutes since I let my my fecal float actually just sit. So now I'm going to take off our slide, just straight up. And just remember that we have everything on this side that is very important. Any ova. Now my cover slip was just a little too small, as you can see, to put it on this big centrifuge tube. So now I'm just going to take this cover slip and put it on top of my sample, and then I'm ready to look under the microscope. The main difference between a fecal flotation and a fecal flotation with centrifugation is that the fecal flotation with centrifugation is actually much more sensitive than the simple flotation. It actually recovers many more cysts and eggs in a shorter amount of time. Okay, the next test I will be doing is a fecal flotation with centrifugation. So it's pretty much the same steps as just a fecal float. What I'm gonna do first, I need 2 grams of our fecal sample. And I will mix it into our fecal float solution. For even distribution. Perfect. Now I'm going to strain it into our centrifuge tube using gauze sponge. Now I'm going to go and spin this sample for 5 minutes on our centrifuge. So I have my fecal float here and another tube to evenly distribute it. And I will close it and I will centrifuge it for 5 minutes. Okay, so I just centrifuged my sample for 5 minutes, and now I will fill it up just to the top, just to form a little meniscus. Perfect. And now at this point, I'm going to place a cover slip on top. We'll allow it to sit for 10 to 15 more minutes. Okay, so I let our sample sit for 10 to 15 minutes, and I'm going to take the cover slide off. And put it on our side, face down, so the liquid is down. And now we're ready to observe it under a microscope. So this specific test is actually a little more sensitive than just regular centrifugation. It actually does help to find more parasites. Okay, so next up we'll be doing a direct smear. This is very, very simple. I actually don't need to centrifuge it or anything. So my items I'll be using today is a slide, a cover slip. I'm actually using a pipette end to get my feces and my fecal flotation solution. So the first thing I'm going to do is actually take my feces, just a small amount, and place it a little bit on the slide. Not too much, you don't want any big chunks. Good. And then I will be taking a drop of the fecal solution and placing it directly where my stool is. Great. Now I'm actually going to mix it with the pipette. Now I'm going to put the cover slip over it, which is right here. As you can see, it's right in the middle. And then we're all set to look under the microscope. Typically, for this one, you look at 100 to 400 power. The main reason why we do direct smears, it actually allows us to see protozoan parasites, which are very, very tiny. For example, Giardia. Okay, so our last test that I will be doing is a fecal sedimentation. So the main reason why we do fecal sedimentation is actually for larger animal parasites typically. We do it for parasites that are too large to be seen on a fecal float or centrifugation. So specifically fluke eggs, they're too heavy, so they will sink for fecal floats. And oftentimes actually the fecal flotation solution actually distorts them and causes us to not be able to recognize them. So the first step I'm going to be doing in our fecal sedimentation, I have here is tap water, and I'm just gonna mix about 2 grams into my tap water using a tongue compressor. So it's the same thing with the other fecal tests, just make sure that it's evenly distributed. Now taking my centrifuge tube, I'm going to strain it using a gauze. Put the gauze right on top. And I need about 30 mils to go in here. So now I'm actually gonna let this sit for a half hour and just wait to see what we see. Okay, now that I allowed my sample to sit for 30 minutes, I'm going to, using a pipette, I'm going to take a small sample of the top of our sediment that we have without disturbing any contents on the bottom. Great. I'm going to place just a few drops, probably 1 or 2 drops, you don't need a lot, on our slide. And then placing my cover slip right over it. And now we're ready to look under the microscope. Okay, so we just took a look at all of our slides, doing all our 4 different diagnostic fecal samples, and they all came back negative, which is great. Okay, so today we have Lily with us, and she came in because her ears were very, very itchy, and she had a little brown gunk in them. So we're going to do an ear cytology. So right here I have 2 long Q-tips. So first I'm going to do her left ear. I'm just going to get a sample, not go too deep. If you want to come closer, Como. Just like that. See? So since it's her left ear, we always like to break the left side, just so I know that that's the left ear. And then I'll do her right ear. Great. Then, now we got our sample, and now I'm going to put it on the slide. With our frosted side up, I'm going to take her left ear first and just gently roll. Some people even like to make an L just so we know that it's the left side. And then I'll take her right one and do the same thing. We want to avoid big chunks on the slide. Just like that. And now I'm ready to stain it. Okay, so we have our ear cytology here. So the first thing I'm going to do is heat fix it. So this will help any yeast or bacteria that is on the slide to stay on the slide, so it doesn't come off either when I'm dipping it in the stain or when I'm washing it after. So now I'm just taking a paper towel and actually washing just the black debris off the bottom. Great. Now I'm going to dip it in our first stain. So I do 10 dips.
Nothing too fast, it doesn't have to be too slow. Good. And then 10 dips in a second. So we have 2 different stains, one for our blood smears, and our blood cytologies and our skin cytologies, and then the other for our ear cytologies. And obviously dipping this on our ear cytology stain. Okay. And 1 more stain, and 10 more dips. Good.
I'm just going to gently rinse off the stain on the slide. now we'll let it dry just for a few minutes and then we'll take a look under the microscope. Okay, so now we're going to take a look at our ear cytology. So I'm first starting off at only 4. So first I'm just going to move this slide so I get a good view of exactly what I'm seeing. So I'm just using the fine knob right here just to make it a little clearer. Good. Now I'm going to move it to our higher plane, 10 times focus. Perfect. It looks nice and clear. So now I'm okay to move it one more to our 40. Now I'm going to use the coarse knob just to move it to get a clearer view. Great. And now the next step, so the next level we have, actually we need immersion oil to put on the slide before we move this. Okay. So I'm just going to move it in between and put a drop of the immersion oil on. Now this is our 100 times view, our high plane, our highest plane. Just like that. Now I'm just going to adjust. I'm going to brighten it a little bit as well. Okay, so the final diagnosis that we saw in the ear cytology, on the left ear there was about 2 Class Ds, so we are going to send them home with antibiotic ointment, Quattrotop. Today we're going to be doing dermatified testing. I have my agar plate here. I have a little scrub that I'm going to do, and then I have my sterile hemostats. So today Captain came in because he had a few lesions and he's been suffering from alopecia. So I'm actually just going to pluck 10 to 20 hairs from a specific area, mainly focusing around the lesion and around the edges, not directly on the lesion. You ready, bud? So first I'm just going to scrub a little bit just to get off the excess debris. It's okay, kitten. You're going to be good. I know, you're a good cat. That should be just fine. I know. I'm sorry, Captain. You're going to be good. Don't worry. Now I'm going to pluck just about 10 to 20 hairs if I can. That should be more than enough. And then I'm going to lightly press it into our plate here. It doesn't have to be aggressively, just lightly press. Just like that. Yeah, okay, so now we have our plate here, which I'm just going to label. So first I'm going to write our date, which is October 31st, 2018. Then I'm going to write the time we took it, which was around 11:40 a.m. Gonna write our patient's name, which is Captain Love, just like that, and then our doctor who's on the case, which is Dr. Love. Great. So now that I have my sample, I'm gonna put it in a drawer here. I actually already have some water in here, just so that our sample doesn't dry out. So now this sample will actually stay in this drawer for about 2 to 7 days, but me and my proctor Rachel will actually be checking it daily to see if there's any growth, and if there is no growth after 5 days we will discard it, and then hopefully it's negative. Okay, so here we have our culture. So this has been exactly 7 days. At around day 5 we did start to see color change, which indicates that it's only contaminants and there's no fungus present. So what I'm going to do for microscopic evaluation, the first thing is I have a small piece of tape here, and I'm just going to lightly brush over the colony just to check. Perfect. And now I'm going to add a drop of our lactophenol blue stain onto our slide, just like that. And then I'm going to stick the tape directly down, sticky side down. And now I'm going to take a look. So in conclusion, there were rods, but there were no dermatophytes that I saw. Okay, so today we have Mr. McQueen with us, who's actually Victoria's kitty. We're going to be doing a skin cytology on him. So we do suspect that he might have some sort of external parasites, maybe some surface mites. Nothing like sarcoptic mange, so I'm just doing a surface scraping. I'm not doing a deep scraping. So the objects I'm using today is a 10 blade. We have our slide, a microscope slide, our mineral oil, and I'm just using some gauze just to drop the mineral oil. So I have our 10 blade here. So the area I will be scraping is right here near his leg, where he's really been itching and scratching. Oh, I know, Benny. So first I'm going to put mineral oil on our blade, and then some on the slide. Great. So since I'm just doing the surface of his skin, I'm not doing a deep scraping, so I do not need to draw any blood for this. So if you want to see here, so I am not going at a straight angle like this, I'm going at a curved angle of the skin, and all I'm gonna do is scrape nice and gentle just like this. You don't want to go too deep. Like I said before, I do not need to draw any blood. Okay. There we go. Okay, that should be more than enough. Now I'm going to take my blade and just dab it on my mineral oil and kind of scrape the excess off. Just like that. Okay, so now we have our skin scraping cytology, and I'm gonna first put a glass cover slide on it. Just gently place it on top. And I'm gonna take a look just at our 4x magnification.
Put in the notes, just say LWK to start.
Using our coarse knob first,
She's calling an appointment.
and then our fine knob for clearing. I'm not seeing any evidence of any surface mites.
It's a really simple noodle. She's really good.
Which is good. Okay, so what we'll be doing today is doing a necropsy on a rat. I actually purchased this rat from Petco, so I'm not entirely sure yet if it's male or female, but once I take him out, we will discuss it. First, I'm just going to go over reasons why we do a necropsy. So the first main reason really is not only to educate us for anatomy and physiological reasons, which is great. It helps the veterinary community doing necropsies for internal organs and blood, body processes, things like that. So then the second reason why we would be doing a necropsy is to really make sure that our post-mortem diagnosis was correct, which is great. And the third main reason why we would do a necropsy is to diagnose diseases and actually help and probably save other animals, because if our animal that we are performing necropsy on actually has a fatal disease, we're preventing it from spreading by diagnosing it and then hopefully helping the overall herd of the city or town that you live in. So I'm just going to go over personal protective equipment that we're going to wear today. The first is going to be our mask, like this. Then we have our isolation gowns. Which is going to go over my whole body. And then we also have our booties, which will go over my shoes. These are the instruments that we'll be using today for our necropsy. We have our Metabom scissors, our forceps, our scalpel blade holder, and our OR scissors. These are our formalin jars that we're going to put any internal organs in that we wish to send out to the lab to have them tested.
This is a necropsy of a rat. Okay, so this is an adult male rat with blood coming out of the nose. So just make a note of that. I don't really see. This is a slightly dirty coat. No other wounds or contusions anywhere. So I'm gonna open up the belly. Alright, so I normally start all the way up here. And you're just making a midline incision all the way. You have to try not to cut all the way through the abdomen.
He's cute.
So, when you're opening up the abdomen, normally what I do is I pick up right on the linear elbow, like that, and then you make a stab incision, straight in, and up, so you don't damage anything.
Mm-hmm.
This is the spleen here, attached to the stomach. The spleen looks really normal. Maybe a little bit congested, but no discoloration at all. So we can take a sample of the spleen.
Great.
Which really means just submitting the whole spleen.
Larger jar, or is this one?
Yeah, that's probably good.
We have our formula jars. Will you show this, please, Anna? Thank you. Of our spleen.
So we can take a sample of lung. And then I don't know if you can do it in a rat because they're real small, but you're supposed to cut open the heart and actually visualize all 4 chambers. But
It might be a little hard. Okay, now I'm just gonna make sure that I record exactly what I did on here. So this was our sample of a lung. So I'm just gonna write lung on here. And then write our lab rat and his patient ID number. Just like that. And that I will do it for the spleen as well. Okay, just like that. Perfect. All right, Rana. Okay, I will be discussing our protocol for rabies suspect handling and the regulations of New York State, which I live in. So if we do suspect a rabid animal, any personnel that is allowed to handle it must be vaccinated for rabies, or they should have a very sufficient titer for rabies. Typically, I think it's greater than 1.1 to 5, the titer should be. So no personnel that is not vaccinated or has a greater titer against rabies is allowed to handle the suspect in question. So the first step is actually to legally euthanize the pet or animal, whether it is wildlife or not. We have to be in full personal protective equipment, including goggles, a mask, and we also wear our aprons just in case, gloves, and on serious situations we do wear rubber boots, even if it is a small animal. Typically they do that in large animals, but we do it too just for safety precautions. Once the animal is legally euthanized, we will actually cut the head off, and that specific head is actually double bagged and transferred to another facility to be tested. The facility that we actually send it to will send us a shipping container, and that shipping container is where we put the head. For the rest of the body, for disposal, since we will have it in our care, we are supposed to double bag it, keep it refrigerated, make sure that it is in a biohazard bag, and dispose of it as biohazard. So after that, the head is then transferred over, well, before it is even picked up, we actually make sure that it is refrigerated and has 2 ice packs in it. It is not preferred that it is freezed. Once again, nobody else should be handling it other than the personnel that are vaccinated. And then typically once it is sent off to the lab to be tested, it does come back within 24 hours, whether the rabies comes back positive or negative. You always have to be very, very careful with rabies. We don't typically see a lot in New York City, but it definitely is possible. for any surfaces that the rabies suspect has touched, or even the technicians that are working with the rabies suspect, it is preferred and necessary to bleach the area, so that would be 10% sodium hypochlorite specifically, and just let it sit for about 10 to 15 minutes and then wipe down the surface. When handling the rabies suspect head, what you actually do is place it in a biohazard container. Our facility that we actually send it off to sends us specific containers that we put it in. So it would be double bagged in a biohazard, 2 double biohazard bags, and then it also comes with a box. And then we also will put 2 gel packs in there as well. We do not keep the head frozen, we will keep it refrigerated until it is ready to come pick up, as well as filling out forms with the name of the patient, if it is a patient, or any sort of information that we know, species, gender, all of the above, where it was found, and if it could have potentially been affected by anybody else. Okay, so today we're going to be doing a vaginal cytology. So the first step I'm going to do is actually clean the vulva. So I have some diluted chlorhexidine here. I have Rachel holding the tail for me, which she's going to keep up during this entire process. Just going to really try to get all the hair away. This dog is not spayed, so today we're going to be taking a look at the epithelial lining of the vagina just to see what stage of estrus that she's in. Right, great. So now I have my sterile swab, and I also have sterile saline here. So first I'm going to be moistening the swab with the saline. So now the angle I'm going to go in is actually a little higher than a 45-degree angle, and then I'm going to rotate and go a little more horizontal. So first I'm going to part the vulva lips. There we go. Oh, you're a good dog. There we go, just like that. Good work. Now I'm just going to swab it. Now we have our sample. I'm going to take the slide, frost it side up. Now I actually don't want to roll. I'm just actually gently going to brush it up against the slide. Just like that. And we have our sample. Okay, so now we're going to stain our vaginal cytology just to determine what stage of estrus our dog is in. So the first step I'm going to do, I obviously have a clip, and we're going to frost it side up so I know which side is up and down. So starting with the first stain, which we're going to do only in our blood cytology stains, not our ear cytology stains, because we don't want to get the bacteria mixed up. 5 to 10 dips in each stain. Let the excess drip off, and now I'm just going to gently wash it off, just to get the excess stain off.
That's in 2 weeks. But why isn't there any follow-up? Is she ready to talk to them about it?
Great.
Yeah, I let it. Check. She left.
And now we'll let this dry, and then we'll take a look under the microscope.
Leave a message for if you have questions.
Okay, so I'm looking at our vaginal cytology now, and actually what I see is quite a large number of non-cornified squamous epithelial cells. So that means that our dog is in an estrus cycle. So she's not in heat, and she's currently not attracting any other dogs. Currently in the epithelial cells, the nucleus is very, very small, and the corners are very rounded. Therefore, they're not cornified. Okay, so today I will be discussing the 4 stages of estrus cycle. So the 4 stages are anestrus, proestrus, estrus, and metaestrus. So originally for first anestrus actually lasts just a little less than 4.5 months. During this stage, there is absolutely no vulvar swelling. The female will not attract any males nor accept any males. When we are looking under the slide, we predominantly see all non-cornified squamous epithelial cells. Yeah, and it's really nothing too crazy for that. Like I said, it can last a little less than 4.5 months. As her stage continues, the second stage is proestrus. Proestrus averages about 9 days. I think they typically say like 8 to 13 days, around there. During this stage, we do start to see the vulva getting swollen, as well as a small amount of red discharge. Is very, very normal. At this stage, the female will attract a male, but she will also not accept to breed with the male. When looking under a microscope, we would see a very high number of erythrocytes and basal and parabasal epithelial cells, which is very interesting as well. Moving on to our third stage of estrus. So our estrus typically lasts 4 to 13 days. During this stage, the vulva is very, very swollen with pink discharge, which actually, as the stage gets later on, actually changes to white discharge. At this stage in her estrus cycle, she will be accepting a mate and will breed with a male dog. When looking under a microscope, we will not see any neutrophils. What we will mostly see is cornified epithelial cells, cornified squamous epithelial cells. So then our last stage that we will go over is medestrus. So medestrus actually lasts about 2 to 3 months. So as they are ending the estrus cycle and we're getting into the medestrus cycle, we do see a decrease in the vulvar swelling as well as the discharge. The female will no longer be attracting a mate and no longer want to be breeding with a mate. And when we look under the slide, we will not see any cornified squamous epithelial cells at all. So they're all non-cornified squamous epithelial cells. And those are the 4 stages of estrus. Okay, so we're going to start our cross-matching now. So I have our donor blood, we have our EDTA tube and our serum separator tube, and our recipient with our EDTA tube and our serum separator tube. And first I'm going to start with just spinning in our centrifuge our serum separator tubes just to get our serum. Put both in there. Great. I'm going to start it at 5 minutes to get our serum. I spun down our serum in our serum separator tube, and now I have a plain tube with no additives at all. So now I'm going to open this and add our serum into the plain tube. So first I'm going to do our donor blood using a pipette. Perfect. And now we have our donor serum. And do it for our recipient serum. And there's our recipient serum. And now we will move on to the next step, which is spinning down our EDTA tubes. Okay, so now we're going to centrifuge our EDTA tubes. From each end. And that's going to go for 5 minutes. So now I have our centrifuged EDTA tubes. So first I'm going to do our donor tube. So I'm just going to decant the plasma. Now first with our donor, I'm going to take 2 drops of blood and put it into our glass tube. Perfect. And now I'm going to fill it with saline. Now I'm just going to gently mix it. Great. There we go. Now we have our donor. So that will stay right there. And now I'll do the same thing with our recipient. Decant the plasma.
So I'm just being careful not to invert it too much because I don't want the plasma mixed up with the blood.
Brody?
Now I'll take 2
quick
drops
thing,
of this
so
blood
when, Bruno and Spike's dad comes back, just ask him if he wants to do the
right
Lyme
into our
vaccine.
glass
They're
tube.
both due for it, but he didn't tell me before he left, so
Perfect.
that way, because they're
Now I will fill this
they're
tube
due in
up.
September, so
With saline as well.
okay, okay.
Perfect. And then just gently mixing it. Great. Just gonna make sure I label both of them. So first I'm gonna put our recipient's tube in the centrifuge. And then I'm just gonna label our donor's tube. And then put this one in the centrifuge and we will spin. And now we will spin both of these tubes down for 1 minute. Okay, so we have our recipient tube that it only spun once for 1 minute. So now it's still tinted a little red. So first I'm just gonna decant the supernatant. Make sure I'm very careful.
I'll take the other one.
Okay, good.
Erase that one.
And now I'm gonna do it for our donor blood as well. And now we will spin both of these tubes down for 1 minute. Here's our recipient tube after it's been centrifuged for the second time, and I'm just gonna decant the plasma.
Okay, thank you.
I'm gonna centrifuge it for the 3rd time for 1 minute with our donor tube as well. Okay, so after being centrifuged for a 3rd time, I have our recipient tube here. So first I'm just gonna decant the rest of the supernatant.
Immunotherapeutic. Well,
Oh,
At least on the
okay,
sticker.
that makes.
Great, probably just one more. Awesome.
You know who else is gonna be high?
And now I'm gonna start by taking,
Tell her the price.
I'll just take it.
Okay, I put the sticker.
great. So I'm gonna start by taking 0.02 mils of the blood. So I'm using an insulin syringe just because it's smaller and it's much easier to get 0.02.
3
How many
boxes.
boxes of, yeah.
I'm gonna add it to a new tube that I labeled recipient. Great. Now I'm gonna add 0.98 mils of saline.
You seem like you're breaking.
She's in room 4. She just left room 4. She's coming back here.
So this is our 2% erythrocyte suspension for our recipient tube. Just gonna put this in here, and now I'm gonna do the same thing with our donor cells.
First was double bucks. This was like a walk-in diarrhea. This should be quick. Should be.
Perfect. So first I'm gonna decant the rest of the supernatant. There actually wasn't too much in this one. Perfect.
Good morning.
I have
How's the name? My, whatever it is.
I'm doing the same thing, so I'm gonna take 0.02 mils of blood.
Oh, no, it's a different one. I have to answer.
She's doing well. She, I heard her like do a little like
Oh, it's nothing.
thing in the room a couple of times, but he
Can't get her to tell if she's.
Hello, can someone help with x-rays?
Now I'm going to add this to our plain tube, our donor tube,
In a minute.
Okay, thank you.
That's the one she's taking X-rays on. So I just-
and then I'm gonna add 0.98 mils of saline in this tube.
did you put all this stuff on the sheet downstairs, I'm assuming, for nasty
The
hands? Okay.
buprenorphine and the ISAP. Yeah.
You're gonna do it?
So
Man,
now we
no,
have
I'm
our
gonna give the
2%
Buprenorphine first
erythrocyte
and see how
suspension for our recipient
fear,
and our
Lauren.
donor
No,
blood
no
tubes.
fear unless you're already.
Now I have my 2% erythrocyte suspension from our donor and our recipient. Okay, so now I'm going to be making the major cross match. So first I have my donor cell suspension here. I'm going to add 2 drops into a new test tube, which I labeled major.
Yeah. I mean, when we talked about it, I said like because of the age and the weight loss, like this has to be on the list, but I don't think that's what's going on.
Perfect. And now with our recipient serum, I'm going to add 2 drops into our new test tube.
I know you don't like your anal glands. Done. Do you need poop? Yeah.
Great, so this is our major cross match now. Perfect. Okay, so now I'm going to be making our minor cross match. So first I'm going to take 2 drops of our recipium
Done.
suspension.
We just need blood and then she's done, right?
Yeah.
Perfect.
If you want, we can do the blood on the floor if you want.
And then I'm going to be taking 2 drops of our donor serum.
Jug or
Perfect.
allow me to do drugs, okay.
Great, now we have our minor cross
Okay,
match.
and you get to go home and relax.
Okay, so now we're going to do our control donor tube. So with that, I'm going to add 2 drops of our 2% erythrocyte suspension from our donor. Perfect. And now I'm going to add 2 drops of our donor serum.
The Pomeranian in room 1 is so cute.
It's okay. Perfect.
And I put all the meds in already.
And now we have our controlled donor solution. And now I'm going to make
Have you ever seen Sex
our
and the
control
City?
recipient solution.
Oh, I know. Yeah, they told you.
So first I'm going to start with 2 drops of our 2% erythrocyte suspension from our recipient.
Can you, Chris, Amanda, and Aileen come with me? Say it again, sorry. Can you come with me? Okay. I'm going downstairs.
Are you busy?
No, you're not. Oh.
And now I'm going to add 2 drops of our recipient serum.
I don't know. I need to I need to finish my appointment. Are you in with an appointment? I'm trying to finish it. Oh.
Great. 1, 2,
Yeah.
then.
This dog is on ID.
And now we have our donor and our recipient controls. Okay, so now we have all 4 of our tubes. I'm just gently going to mix them. Great. Now I'm going to put all 4 tubes in our stand at room temperature and let them sit for 30 minutes.
More than a gram.
Okay, so now we've waited 30 minutes. Now we're going to spin all 4 of our tubes for 1 minute.
Oh.
Okay, so now I have our major and our minor tubes. So first I'm going to tap on each of them and look for agglutination and hemolysis.
So he does actually need more food, so I'm going to put in it another case of ID stew.
Okay, so there's definitely agglutination in our major and minor ones, if you could see. So that means that there are not a cross match. And now I'm going to test our controls by doing the same thing.
Yeah, I mean, I forgot.
Hey, I have a doctor Dallas from Withdrawal on line 1. She was hoping to update one of our doctors on
Actually, I'm not getting any agglutination, so that's good.
preferably, but she's
I mean, I can mention it to her. We could also do it.
So then no agglutination in our controls.
it looks like
Okay, so now I'm going to do a microscopic evaluation. First, I'm going to do our minor. So I'm just going to take a drop,
The guy told me that he actually had
put it on our slide. And then I'm going to take a drop of our major as well and put it on a different side. Perfect. Now I'm going to label both of them
There.
top.
as major and minor. Great. Now I'm going to take a look at the slide. We're just going to look
You're putting glue on here.
for any hemolysis. So first I have our minor. So I'm only keeping it at a low power slide, low powered view.
It's just, you use it just for work or you use it?
For modeling.
hand lotion?
Yeah.
Girl, get a new bottle.
So it looks like there's a lot of clusters
It's money. I just got this.
indicating hemolysis.
It was dripping. You can get it
And
on.
then I will look at our matrix.
Oh, okay.
It's gonna be in my pocket.
I'm not sure if it's really worth treating another week. It's not effective. It's not doing much. I guess we can do quadratop, but it's not really a yeast thing. It's more of a bacteria.
No.
What are you treating?
It has a little bit of yeast in its ears.
I see the same thing on our
But it
major
had a
slide.
little bit of yeast in its ears last week.
Grape like clusters, which
Hello.
indicates the same hemolysis, therefore they are both
Hi,
not
have you ever
compatible.
been here?